Welcome to this short presentation on preparing for end-of-block written examinations in the Sydney Medical Program. Hopefully some of these tips and tricks will help you in your exam preparation. Number 1. Keep up to date with core activities and engage in constant revision. The volume of content which needs to be covered during the course of the academic year within the medical program is high, reflecting the necessary depth of knowledge required of practicing doctors. As such, adequate time needs to be allocated across the block to engage in consistent viewing and revision of core content. Core video lectures and in-person sessions form the crux of what will be examined in the KAT assessments, and therefore topics explored within these lectures should be prioritised. This said, lectures will not be exhaustive, and students will need to engage in further self-directed learning to help with knowledge consolidation and retention of relevant information. Keeping up to date with lecture content across the block will allow formation of a strong base coat of knowledge, which can be further consolidated with revision. Formation of a strong base coat allows more effective cross-linking with other topics as they arise in future lectures, tutorials, and seminars. Being able to identify topics which are considered high yield and relevant by tutors and lecturers is an important part of engagement with core medical knowledge, and students with strong foundations have a greater chance of picking up these cues, which will further guide targeted revision in the weeks leading up to assessment. Number 2. Reflect on work, study, life integration. It is important for students to reflect on how the completion of core learning activities and sufficient content revision fits into their lives as a whole. Adequate time needs to be allocated to completion of the medical degree requirements as well as revision of content and self-directed learning to allow satisfactory completion of these assessment tasks. Many students find that the demands of the medical program are greater than anticipated, and the complexity and volume of content places a greater study burden on students when compared to their other postgraduate degree units. Engagement with work and other activities should be balanced against the individual student needs to successfully complete the academic workload and consolidate required knowledge for successful exam completion. It is acknowledged that some students will need to continue with employment outside of the medical program to support themselves as they complete their studies. If you are finding yourself in difficulty finding a social or financial balance, there are services available through the medical school and the university to assist you. These include the Student Life Canvas site available through the Sydney Medical School. Reflection on study, work and life integration is an ongoing process and should be something that medical professionals continue to do through their postgraduate practice well beyond medical school. You will find that as your life and practice evolves, you will need to continually adjust the balance based on shifting priorities. Keep in mind that your priorities and balance of tasks will be unique to you. Number 3. Integrate your study topics. The graduate medical program is about fostering the development of higher level thinking skills and knowledge. Part of this is drawing together knowledge across disciplines. For example, clinical skills, pathology, gross anatomy, and histology allow future doctors to engage in active patient problem solving as they deliver a high standard of patient care. It is worthwhile starting to develop these skills as medical students. In addition, making links between lectures and knowledge across disciplines help with the knowledge retention. Seeing specific facts within the broader context of a diagnosis, body system, or physiological process assists students with understanding topics better and is linked with high success in examinations and eventual practice. For example, if you are learning about renal physiology, it is worthwhile considering how this links in with the anatomy and histology of the kidney, and then going on to link these basic science concepts with manifestations of disease. Number 4. Switch up your study style. While there are some learning opportunities which are common to all students, for example, attending seminars and viewing video lectures, styles of engaging with the initial content for best retention and how you choose to revise the individual content varies across students. As we are all individuals, we'll learn in different ways. This may mean that you choose to listen to the content the first time around, annotate slides, or take typed or handwritten notes as you listen. You may like to revise by listening to podcasts or audio recordings, rewatching videos, or finding other audiovisual explorations of the topic, reading textbooks, writing or revising flashcards, writing comprehensive notes against learning outcomes, making your own visual revision material in PowerPoint or a mind map, or a combination of different study styles. It is also worthwhile considering that different study styles themselves suit different topics as well as different student moods. Switching between different study styles across the course of a week or even over months can also help students to maintain interest and engagement with the content so that they can continue to study consistently and effectively. A student may set out for the first 3 weeks writing comprehensive notes about lectures, but then switch to more creative ways to engage with the content, such as drawing mind maps and annotating slides, then moving towards greater engagement with practice questions and flashcards as the block draws to a close. For some students, working towards a perfect set of study notes is tempting, but sometimes you do need to give yourself permission to trust that different learning styles can still deliver the desired result of comprehensive review of the content. In fact, engaging in different ways can help prevent you from getting bogged down. It can also be useful in revising content that you find more difficult, as a different approach to learning can unlock a different level of understanding which may not have been possible with your favoured methods of study. Number 5. Start to think like an examiner. In many cases, the examination questions have been written by the authors of lectures and other teaching faculty involved with delivering the block. With this in mind, it is worthwhile examining the core content and learning outcomes through the lens of someone who may be setting the assessment to think about which concepts could pop up in the exam. You can consider which concepts are considered high yield, that is, important information for eventual clinical practice or within the understanding of the pathophysiology of a core condition. A lecturer may indicate during the delivery of a lecture, seminar, or tutorial that they deem certain pieces of information important, and therefore it is worthwhile that the student pays close attention to these concepts during revision. Some pieces of information and concepts also lend themselves better to evaluation in multiple choice or single best answer question format, and these could be identified within the lectures by the students undergoing revision. To hone this skill, you may try writing a handful of multiple choice questions based on a lecture learning activity you have just attended or revised, focusing on what you believe the educator felt was important or what you know to be important based on the context of the information and further learning you have already done. By thinking like an examiner, students can also start to improve their exam technique. One such component of exam technique is considering why the examiner has elected to write that particular question, that is, why the information is important, which then can give additional context clues to help the student in providing the best answer. Using practice examinations effectively. Practice examinations are a useful tool for guiding the final stages of preparation before an exam. They should not be considered as a direct indicator of success in the final exam, however, and should be looked upon as more of a tool to gauge your competence across different areas of the curriculum and content, rather than looking for reassurance. Practice tests may or may not be written or set by the same authors who have created the final exam, and similarly may not be directly comparable in terms of difficulty or the specifics of the examined subject matter. A trap in which students fall into is placing too much emphasis on the pass-fail aspect of the practice exam. If you anticipate the final exam will have a pass rate of 60% and you receive a grade of 65% or even 85% in the practice examination, this should not be taken as an indicator of guaranteed success in the formal exam. The greatest value of completing a practice examination is to unearth areas of the syllabus or unearth high-yield content which you may not have mastered and may not have realised that your knowledge could be improved. After completing the practice test, it is most worthwhile paying attention to the questions which were answered incorrectly or those questions which evoked a sense of discomfort or uncertainty while they were being attempted. Uncovering these deficiencies in knowledge several days before the summative assessment is attempted is a very useful way to help guide the final days of study. Lastly, ask for help. If you are having difficulty with the content and you are unable to resolve the question via self-directed learning, it is worthwhile reaching out to the faculty member who developed the resource or other subject matter expert who has been part of the teaching within the block. Ideally, this should be done as early as possible, as academic staff often have high clinical and administrative loads and may not be able to provide a timely response. If you are having difficulties in general completing the learning requirements and necessary revision within the block for personal or academic reasons, there are dedicated staff members who are on hand to help. These include the university and clinical school-based staff who are focused on student wellbeing and academic support. During your year in the program, your first port of call may be the year coordinator, your learning advisor, or clinical school staff. Further information is available at the Student Life site on Canvas. As we come to a close, keep in mind that all students have different approaches and study differently. You all have different strengths and weaknesses, and because one thing works for one student doesn't mean it will work for everybody. Take this advice with a grain of salt and work out what works best for you. Thank you for listening.